Welcome to another edition of Well-Adjusted Mama. I'm your host, Dr. Laura Brayton, and today's guest is Dr. Claudia Anrig, who is a colleague, friend, and coach to me, and I am so grateful to have her in my life. Dr. Claudia has been in practice full-time for the past 30 years. She is the founder of the first pediatric program that introduced the concept of family wellness through chiropractic, Peter Pan Potential. She also personally mentors chiropractors with a dream of growing their family wellness practice in the Generations Mentoring Program. She is a past president of the International Chiropractic Pediatric Association and the Gonstead Clinical Studies Society. She received the Chiropractor of the Year Award for 1997 from the World Chiropractic Association, Fellow of the International Chiropractic Association in 1997, and Distinguished Service from the ICA in 1998. Dr. Anrig's textbook, Pediatric Chiropractic, is the first of its kind and is the fastest-selling textbook in chiropractic history. The highly anticipated second edition was published in late 2012. Welcome, Dr. Claudia.
Thank you so much, Dr. Laura, for having me as a guest today.
Oh, I'm so happy to have you here, and today's focus is going to be really sharing with our audience about the value and the benefits of chiropractic for women preconception, during their pregnancy, after birth, as well as for their infants and toddlers. So I'd love for us to start off with you sharing your personal story of why you became a chiropractor specializing in family wellness care.
Oh, that's great. When I was a little girl growing up, my mom was one of those chiropractic miracles. An individual during her third pregnancy, my mom could not walk, and as a result of it going to the orthodox medical approach, it basically said, maybe hopefully after you give birth to your child, the third child, maybe you'll be able to walk again. But unfortunately, my mom was not able to walk, and she was crawling. And after months of this issue, my little gentleman, a grocery store guy, had mentioned to my dad, what about going to see a chiropractor? And so my parents, who were immigrants from Switzerland, not knowing what chiropractic was even about, they just were looking for hope and faith. And so they ended up going to see a chiropractor. And after he x-rayed and examined her, within a few weeks my mother was walking again, and she had just her whole quality of life had changed, which meant our quality of life as a family had changed as well. And my parents were so intrigued by this kind of very natural approach. They started as 3 children under chiropractic care, and we were all under the age of 5. And uniquely, my brother's asthma bedwetting went away. My sister's ear infection went away. And we just approached chiropractic like it was just like a part of one's lifestyle. And when I was 6, ready to turn 7, Dr. Laura, my parents asked me, Claudia, what would you like to have for your birthday gift? And I said, Mom and Dad, I want full spine x-ray so I can go teach everybody in second grade why they need to have chiropractic care. And so I guess I kind of was destined at a very young age that that's what I wanted to do to grow up. However, my dad beat me out. Dad was an engineer first and decided to become a chiropractor. And so our legacy, as my father started chiropractic college first, and then we followed myself, my brother Daniel, and my sister Susie. We're all chiropractors practicing together in Fresno, and even now my mom is our office manager, so we really are very committed and passionate about a family wellness care. So part of that is when you're raised not knowing anything better but a holistic approach that imagine I'm a little girl, and if my body wasn't functioning right, it didn't feel right, my solution wasn't a chemical. I was raised naturally, and so I would think, I need to get an adjustment by my dad. I have to rest. I have to have maybe take some supplements, but eat healthy. And so I had a different paradigm years ago, which is now becoming more popular with progressive parents. They want to give that same opportunity to their children, is start young, integrate chiropractic, because it's all about that function of the nervous system.
Right. That is such a cool story how, were you the third child?
I was the eldest, and so
okay.
Yes, and so we would just go to the chiropractor for not because we were symptomatic. We went to the chiropractor. My parents looked at it almost like early intervention, like dentistry. Go early, stay healthy, and so we just would go for regular chiropractic care at least twice a month to get a checkup to see if we need to be adjusted at that visit.
Yeah, so it's really so interesting how life, shows us our path and where we're supposed to be, and that's what happened for everyone in your family. Everyone's is in the chiropractic career. That's so neat. Could you please share with us about the benefits of chiropractic for women preconception?
Oh, absolutely. Probably 10, 20 years ago, we would never have thought about preconception care. As a matter of fact, that's when I'm teaching and lecturing and writing. This is an area now that I'm really focusing on, and with my doctors I'm even mentoring, the importance that we create a relationship with our patients who are thinking about getting pregnant to really get into the preconception lifestyle. The way our Western living is, we're exposed to a lot of negative chemicals in the air we breathe, the food quality that maybe somebody's not eating as well, or the food is depleted, maybe it's not organic, it's not clean. And so between the chemical exposures we have and the high stress level that as women that we're just exposed to, which then changes us hormonally, and puts us at, by the way, higher risk to having miscarriages or not conceiving. So between the chemicals, the stress level, and then also, too, physically, if you're not at your best, many women have jobs now where we're sitting and we're not moving our bodies, and also we're delaying getting pregnant into maybe our late 20s and our 30s. Sometimes the stress that we're under physically, chemically, or emotionally can interrupt our ability to conceive or maybe having the healthiest pregnancy that we could have. And so I believe that every woman who's thinking maybe a year out prior to getting pregnant, that they should be seeing a family wellness chiropractor and getting a good review and dealing with every component that can possibly be ready. And that also, by the way, of their partner, because it takes two, by the way. And so their partner, their spouse, to really go also through a preconception, maybe it's detoxification, it's a nutrition approach, it's getting under regular chiropractic care. Nothing's more powerful than tapping into the function of that nervous system, which controls all systems of the body. And so preconception in this day and age, I think it's vital that we do this, because I think for the mother-to-be, she'll be much healthier during her pregnancy, but really this preconception work is really we're advocates for the baby. Just yesterday, a little girl that I took care of when she was just 6 years old. Now she's married, and she's starting to think about her family. And so we did a preconception journal, and I will be reviewing that and setting up an appointment time and reviewing all the aspects of that so I can help her journey and her husband's journey in this next year when they're thinking about conceiving their baby. And what I'm really looking forward, I'm starting to get to adjust, Dr. Laura, the babies that I took care of, I'm now taking care of their babies, and nothing is more of a blessing to see healthy people having healthier children. It's just a marvel direction to go to.
And, that's such a good point that you're making. With these lifestyle choices, this is really impacting future generations. So having a woman prepare before getting pregnant is going to help her future child, and will help her future grandchildren as well.
That's right. And so as we work with our women maybe 6 months to a year in advance, then the second stage of our responsibility is to have a prenatal relationship with our pregnant moms. And so it wouldn't be like hit and miss. Well, just, whenever you're not feeling right, come in. Or don't think about if you're pregnant, well, I'm only going to see a chiropractor if I'm having lower back pain because of my pregnancy. Oh, absolutely not at all. What you want to have is an ongoing relationship, and that would be determined between the doctor's analysis, what your needs are. So one woman might be coming in weekly, and somebody else maybe every 2 weeks out or 3 weeks. And the care during the pregnancy in first, second, and third trimester is really unique. It may mean less fatigue, more higher energy, less morning sickness in first trimester. In second trimester, your body is going through kind of a center of gravity change, and so it can help you balance your upper body to your pelvis and have less likelihood, yes, of back pain and neck or shoulder discomfort. But imagine that if the mother is at the highest level of nervous system function. Remember, the first thing that was ever created in the body is the brain. The second thing that is ever created in the human body is the spinal cord and nervous system. And then after that comes muscles, organs, glands, and so forth. But as a family wellness chiropractor, we're working with the the second thing that was ever developed, the nervous system, that is who a family wellness chiropractor is. They're your specialist to your nervous system. They're the master controllers of how all systems work. And so for the benefit of the mom and the baby, having somebody who's your specialist during your pregnancy, it's just really vital that mom has no interferences. And then the last trimester, we know that if the pelvis of our moms are in a proper alignment, imagine that the sacrum, which is your tailbone, and the left and right hips or iliums, imagine that as like a basketball ring. And the ring needs to be nice and round. And as your wellness chiropractors, we're able to adjust typically your sacrum, sometimes your hip, and allow you to have a really round hoop to have, because at the 7th month, your baby needs to get in a head-down position. It's called vertex, and it's a vertical line up and down. But if the pelvis is not round, then sometimes what will happen is your baby will, quote-unquote, get caught. They call that in medicine in utero constraint, and what that does is puts a lot of external pressures on your baby, on their muscle and skeleton system, and then it can interfere with a more natural labor and delivery. And it can put a lot of strain on the baby's spine. And so it's very important at the 7th month that your baby is in a head-down position or vertex, so there's no external forces putting negative pressure on your developing baby. And that's, again, part of the focus of a family wellness chiropractor. She or he is going to really work on making sure you have a round pelvis. And if, you get a diagnosis where, oh gosh, my baby's in a wrong position, many times, Dr. Laura, people don't, whether it's a midwife or sometimes the OB, is not so concerned at the 7th or 8th month. But what's best for the baby is to be in the natural position. So we encourage you, if you find out that your baby's in the wrong position, please seek out a family wellness chiropractor and have the Webster technique performed on them.
Mm-hmm. It is so true, and some OBs really kind of wait till the last minute to let a woman know that the baby is in a breech or transverse position. So as I'm working with my women during their pregnancy, at the beginning of their 3rd trimester, I'm already mentioning, hey, let's just confirm the baby's position. Make sure you just ask at your next ultrasound or your next OB appointment or next midwife appointment that the baby is head down, because it really impacts that baby's development, and it certainly will impact the birth.
Absolutely. And this is in the follow-up of, and by the way, when, let's say you do find that the baby is in a wrong position, well, what our audience needs to know is that with specific chiropractic care, sometimes within 2 to 5 visits, within a week to 2 weeks, we can help the pelvis be a rounder bowl, and so your baby has an innate or an inborn intelligence. The little one knows it needs to go head down. So that's all we have to do is just get rid of the interference, like the little hurdle. You don't have to jump over that. Just get rid of the hurdle so the baby innately, or with its own inborn intelligence, can get into a natural head-down position. There must be something important that at the 7th month the baby innately needs to be in a head-down position. So what we do as chiropractors is just eliminate the interference. Nature does all the rest.
Mm-hmm. It's so cool. It's like the baby knows innately, like you mentioned, that it is supposed to be head down in preparation for that delivery. And so it's so helpful. And even if the baby is in a position like sunny side up, it still may be vertex, but chiropractic can help the baby turn into more of an optimal delivery position.
Absolutely. And then once our moms have their little ones, it's really important to have a postnatal care, because somebody needs to nurture you. All of a sudden you have this little one that needs everything from you, from breastfeeding to just skin-to-skin contact, and that's so important. But your body just went through like the Olympics, and there's hormonal changes. And for our women to realize that the hormone relaxant from the moment you conceive is rampant, depending on between 8 to 10 times as strong in the human body. But postnatally, that hormone relaxant that keeps the pelvis as a joint to be more looser, to move easier, to accommodate a pregnancy. Postnatally, that's in our bodies 9 months after our pregnancies. And so it's real important that you have follow-up care. And ideally, depending if it's a home delivery or it's a hospital delivery, within 24 to 72 hours, you need to be rechecked. You need to be as healthy as possible. And for many women, too, that's going to help you engage maybe with breastfeeding. And postnatally, too, please make sure you bring your newborns in for care. Let your chiropractor do a chiropractic, very gentle palpation exam. It's almost like fingertips are walking, and it's very light pressure on the baby's spine. Because sometimes even in a natural birth, Dr. Laura, as you know, checking your postnatally, your babies, sometimes as the baby's going through the birth canal, there's not birth injury or birth trauma, but what I train doctors to realize is sometimes there's birth strain. There's just a little strain in the neck as you're coming through the birth canal. So it's almost like a sprained ankle, a sprained neck, or middle back can occur just naturally, but it's still interfering with the baby's nervous system. And so if we examine the spine, and also we can check if the baby's having any issues with latching on, if the baby's having any issues with colic or reflux. Those are things that naturally be cared for by a family wellness chiropractor. And with the lightest pressure, that's how we deliver an adjustment. Not like we do in adults, but it says feather light to make a correction. It's very easy to adjust a little one.
Yeah, and it's so important, and it's safe. You know, a lot of people may not be aware that newborns need to be checked by a chiropractor, and it's important, and we don't want to wait until they're older to make those corrections, those misalignments, corrections to the misalignments that occurred during birth. Ideally, we want to correct them as soon after they occurred as possible.
That's right. Because some of the silent signals that might occur because a baby or a child does not manifest, quote unquote, back pain. But right. Some of the silent signals that they look for is like digestion and elimination. So if a child or a baby is not having regular bowel movements, that could be a result of an interference to the nervous system. Digestion, the little child who's the picky eater, that's a silent signal that maybe their digestive tract isn't right, or the baby with reflux or colic, and so that's a silent signal. Another silent signal is your child's immune system. If they're always getting colds or earaches or ear infections, that's a silent signal that maybe the immune system is being compromised via the nervous system. And we cannot tell you how many parents come back after their child starts chiropractic care and say, oh my gosh, since I started chiropractic care, my kids aren't sick anymore, and they digest well, they are going poops well. Those are important signs. Also, posture as a result. Is there something structurally going on? And so if your child is having slumping shoulders, or they just seem to, because of technology, they're leaned forward a lot, with playing and with activities and doing homework, those can put stressors on that child's spine. And so those are another kind of silent signal. And here's two other ones. Your child or your baby does not sleep well through the night. That's indicative that maybe something's going on with the nervous system. And the last one is behavior. Grumpiness, irritability, anxiety, tension, the baby who's just not comfortable in any position. That could be indicative to a silent signal that your child or your baby's nervous system isn't functioning so well. So why not take the natural approach and go to the most natural doctor who knows how to examine and do a gentle adjustment, and within sometimes 1 or 2 visits, that is eradicated, and your baby, your child, is functioning at its highest level.
Right, and that's the big message here is chiropractic is not about back and neck pain. It's really about the function of the nervous system, which is why it's so important for women preconception, during the pregnancy, even if they're not having any back pain, as well as for a newborn and infant, toddler, who once again is not going to be complaining of back pain, but could still have a misalignment in their spine called a subluxation that will create symptoms and create a dysfunction in how their nervous system is working.
Right. And what's really important, I believe that as families, you have to have a team around you. And just like you will, as your child gets a little older, you'll have like a dentist for the prevention of dental problems. You have people who are like on the prevention end in your life as a part of your team for your family or for your children. And that's how you should see your family wellness chiropractor. She or he is at the prevention end. They're part of your team. And by the way, what's really unique about having a family wellness chiropractor, Dr. Laura, as you see in your own practice, we're resource tellers. So we're there to help you introduce maybe when's the right time to introduce what food so you don't end up with food allergens for your child. So we deal with nutrition, stress management, repetitive stress to your child's spine and developing nervous system. So all of that, who do you go for the wellness information? So whether you provide newsletters, you provide literature in the office, or family wellness chiropractors often will teach workshops. Who do you go to how to raise a healthy child? And that's who we are in family wellness chiropractors. We want to be there for you. We want to provide that information. So you have a whole team. You have your dentist. You have your family wellness chiropractor. And yes, a majority of you will have a pediatrician, but that usually you're going to fall back on the pediatrician when something really major has gone on, like a broken arm or something like that. So you have a team from wellness to emergency care and a part of that spectrum. Now, by the way, who do you see more often in a relationship to wellness? You will probably see your family wellness chiropractor more often because she or he is going to be checking your children because, by the way, they have all these falls and tumbles, and so they check you more often. And where the pediatrician would be more on the emergency end of it, something catastrophic. And so the relationship that you build with your family wellness chiropractor is because she's going to want to check, or he's wanting to check your little one on a more regular basis just to make sure your child's spine and nervous system is growing well. Also, I just want to point out, do you know that in your baby's first 2 years of life, your baby's spine will double in the first 2 years? And if you look at how little babies to toddlers fall, tumble, bump their heads, and all the rest, you have 3 windows of time to grow a healthy spine. And after that, once you're past 18, that's it. The most critical time to have a wellness chiropractic relationship is from in utero, from pregnancy, from birth to the first 5 years. Your child's spine needs to grow straight and have beautiful curves. The second window that you have to follow through with then is from 5 to about the age of 10 to 12. Really critical, because if they're having falls or tumbles or playing sports, their spine will start to grow incorrectly, and they'll have that pattern for forever, till the end of their lifespan. They'll always have to deal with it, and then from age 10 to 12 to age 18. So these windows are really critical to have a relationship with a family wellness chiropractor. Let us help your child's spine grow healthy and well, which will impact their nervous system, the way their organs and glands and their systems will work. It is the best investment in your child's overall well-being.
Right, and this is really about prevention. It's not ideally waiting until the child is sick with an ear infection or getting colds frequently, but it's really about, being preventive and just maintaining that proper spinal alignment so the nervous system is functioning normally. I have little kids in my office who will know when they need an adjustment and will ask their mom or dad to bring them in, and it's like really cool to me that they know they're not going to complain of pain, but they know that they're off and they know they want to turn their power back on.
That's right. And because if you've raised somebody who is well, they intuitively know what well or good feels like, they will tell their mommy and daddy, I need to go get checked at Dr. Laura's house, or I need to go get checked at Dr. Claudia's house, because sometimes they believe we live where we practice at. And they intuitively know, because if you know what well is like, you see, in Western care, we basically learn to suppress our feeling, or let's take a chemical and cover it up. Well, that's not a good pattern to teach little children, to cover up your emotions or cover up the way your body is feeling. So covering up is not a good idea, because later on in life, in our age 20s, 30s, or 40s, or 50s, it catches up with us. So for our little ones to be so intuitive, they know to get checked. They know their inner doctor knows what well feels like, and when they're off kilter, they'll even communicate that to their parents. So I tell my parents, embrace it when their child is listening to their inner wellness. Yeah. They're telling you they're off a little bit. Let's go get it checked.
Because unfortunately, so many adults forget about that and don't listen to their body and what's going on until the body's screaming. And so it's really great when you start to get those subtle symptoms as a child. They're listening, and they're not going to wait until the problem is worse. They're like ready to take action. And the other thing is their bodies heal so quickly. They don't have that years of wear and tear like an adult does.
That's right. And so when you have, let's say, a wellness checkups with your chiropractor's office, it's not like if, as an adult might enter chiropractic care, they have to have more frequency or higher intensity of care. A wellness care relationship, it might be that you are bringing your child in to get checked twice a month. But checking doesn't always mean also, by the way, that you're adjusting. You're just checking to make sure in the last week or the last 2 weeks, did anything happen while the child is playing and jumping and doing all the goofy things that they're doing? Look, you cannot put your child, wrap them in bubble wrap, and they're never going to have a fall or a trauma. And every little fall or trauma they have are little sprains kind of to their little spine, and eventually it can begin to interfere with the nervous system function. And so as your wellness chiropractor, we're just doing a checkup. We're just going to check them. And by checking them, see whether rule in or rule out, do you need to be adjusted today? And if not, okay, we'll see in a few weeks. And then as the child gets a little older, and maybe depending kind of what lifestyle they're doing, if they're heavy in sports, they may need to be checked more frequently. If it's a more passive child, then maybe they need to be checked less frequently. And that's our role as in our relationship with our families, is to adapt our adjusting checkups with you depending on the needs of each individual in your family.
And that's such a good point you made is, when a child does come in, they're going to get checked for those misalignments or subluxations, but if they don't have any, then there's no adjustment, there's no treatment for that visit. It's really just to confirm that everything is holding its proper alignment, and then if there is something out of place, it will be corrected. But an adjustment's not going to be delivered if there's nothing to correct.
That's correct. And so sometimes can imagine if you don't have maybe a group of holistic other families you're around. Imagine as you're talking to your family members or your friends, and they're going, oh, why are you going to the chiropractor with kids all the time? Your kids don't have a bad back. I'm going to encourage you as moms and dads to really, you have to say, well, you know what, my approach is a little bit differently. I see going to our family wellness chiropractor, he's like my dentist. We're doing the prevention work. But with the spine, and we need to, as a parent, be aware of it. How do you communicate that to that parent? Look, I have a window of time for my little kids to grow up straight and have the right curves in their back. And when I was a kid growing up, and this is you, the parent, I didn't get that opportunity. And I'm going to be more progressive with my children. I am not letting my kids grow up to develop a spine and an interference to their nervous system. Now, as an adult, they have to live with decades with those issues. Mm-hmm. It's only the first, 18 years, and it's just minimal wellness checkup. But what you do the first 18, that you're talking 60, 70 years later. That's the benefit of the investment on those early ages. And so I'm going to encourage other parents, when you have others who might just say, well, gosh, why do you let them know? Hey, if you take care of this the first 18 years, we have a whole lifetime ahead. My child will not have the adult problems like maybe you have right now.
Right, and that's another thing that, I have a lot of young professionals who come into my office in their 20s and 30s, and on x-ray we'll start to see some degeneration and arthritis that typically would be in a spine much older, 40, 50, 60 years old. And so that takes many years to develop, and that's an indication that they did either micro or macro traumas as a child that have now created where they're at today that could have been prevented and corrected if they had been under chiropractic care as a child.
That's correct. And so that's just a whole new wellness model. And that's, more and more progressive parents are going in this direction, and whether they may share it with you or not, but this is really, the direction of the future. And I believe in our lifetime, Dr. Laura, that we will see parents really embrace family wellness chiropractic care because they're going to pick that person or persons to really be a part of the wellness, the wellness part, just like their dentist. They're going to pick the wellness component of that, and it's going to be, it might not be like their past chiropractic experience when they went in for adult care for relief, but it's a whole new embracing of a lifestyle and putting other team members in place.
It's the same idea as going to the gym regularly and brushing your teeth regularly, changing the oil in your car. This is about maintenance, and our bodies need tune-ups to run at their optimal level.
That's exactly right. And always going back, if you can go back to how was your body created? First thing that was created was the brain. Second thing was spinal cord. Then came the nervous system part, the whole system. I just always ask my patients, who is caring for your nervous system? Who's your specialist that is into the wellness and prevention? Who is going to help manage that, co-manage that with you, be a part of it, be your facilitator? And it's really simple. The only person that is trained is a doctor of chiropractic to examine the spine, to see how it's interfering with the nervous system, to deliver a spinal adjustment, and basically assist you, facilitate your own function. You have the natural ability. Your children have the natural ability to be well. But what you need is who is going to be your, in a sense, your mechanic on the side when you have to pit stop, change the wheels, get everything lined up so that you can run your race in life. And who is your specialist in your nervous system, because that controls everything. And the only one who's dedicated to doing that in a wellness paradigm would be your doctor of chiropractic.
Yeah. And it is really, including the entire lifestyle, chiropractic lifestyle. So in addition to adjustment, like you mentioned earlier, it's about discussing your diet and what your, foods you're putting in your body, as well as, other environmental exposures like skincare products and household cleaners. A family wellness chiropractor can help educate a whole family. And in my office, and I know you see the same in your office, whole families will come in to get chiropractic adjustment. So it's like it's a family event. They come in together for the appointment. Mom, dad, baby, toddler, all get adjusted on the same time, and that's also very unique. You're not going to see a lot of doctor's appointments where a whole family gets a treatment the same day.
That's right. And again, and because we embrace this wellness approach, we want mom, dads, and the kids all together getting their adjustment. And, there's a lot of giggles going on. And, so many times we see the little kids putting their hands on their mommy's or daddy's back and wanting to do a little what we call push and be a chiropractor as well. And isn't that just a wonderful testament if children are learning, we're doing this together as a part of the wellness model. And I've practiced long enough that my babies are having their baby. They got the whole concept. They've been under care through their 20s, and now they're getting married, starting their own families, and they understand this is second generational. That why would they've been well all these years, and just to understand everything from preconception through the prenatal stages of things, just raising a healthier generation. Because every time we can influence that, you just don't know the ripple effect that has down the line.
It's so huge. And there's one more point that I really wanted to make. You had talked about a woman in her third trimester getting chiropractic to help her pelvis be more like a round, birth canal, so to speak. Can you speak a little bit about how that will impact the actual labor and delivery?
Yes. If you can imagine the pelvis, again, being a round hoop, like a basketball hoop, mm-hmm. And then if the hoop is twisted, meaning mechanically it's not in that round position, then imagine the net being all the muscles and ligaments in the pelvis. And so what happens is the netting, in a sense, gets twisted. And when you twist the netting, then as the baby's going through the birth canal, that's putting a lot of outside or external stresses on internally the woman's own pelvis, but it also, that torque or twist, is interfering with the natural delivery of that baby. Something that should just only take sometimes maybe a couple of hours ends up being 10, 15, 24 hours. And so often it goes back to just basic mechanics. If the pelvis is round and there's no interference to that nervous system, then the netting is not in a torque, and it's not putting out external pressures on the internal organs of the mom on her mechanically. But it's also not doing that. It's not impeding the birth of that child.
Mm-hmm. And so you've seen how it can really, make a difference in the woman's experience of birth.
Yeah, often my women, when they are going into their labor, within an hour and a half, they're getting an hour and a half to 2 hours, they're giving birth to their first child, the second child, whatever it might be. They're having short labor and delivery time because everything is at a high level of function. Sometimes as chiropractors, we even meet our women down at the office, adjust them while they're in labor as they, go off to the hospital, or if they're going to have a home delivery and so forth. We're even adjusting, during that process so that we can help them have the most optimal labor and delivery.
Mm-hmm. It's, the brain's communicating with the uterus, and so everything, the body is knowing what to do. This natural process of giving birth doesn't have this interference.
That's correct, and so that's a wonderful role that for those who are going to be future moms, or somebody who's thinking of having their maybe second or third child. Just imagine the fact that you're missing a big piece of that puzzle, but by not taking care of, again, the pelvis, and just knowing that as the baby takes up all the space and mechanically your body's going through changes. This is why we really encourage, for those who are thinking about getting pregnant, start a preconception relationship now with your chiropractor. Get well now. Don't try to wait till after you become pregnant. And then those who are pregnant right now who might be listening to this podcast, I would encourage you, find a family wellness chiropractor now and get a wellness relationship going with that doctor and making sure that they're adjusting that lower back pelvis of yours so that you have optimal function.
Right, and that leads me to my last question. If someone listening to this podcast does not live in the Fresno area and they can't go to visit you at your office or in the Hoboken area and visit me in my office, how can they find a trained family wellness chiropractor?
That's great to ask. As a past president of the International Chiropractic Pediatric Association, I would encourage all individuals to go to ICPA4kids.org. And again, that's ICPA4kids.org. And that is a wonderful organization. There's several thousands of us internationally who are seasoned wellness chiropractors. We are spread out throughout North America and Europe and Australia, New Zealand. And we encourage you to create a relationship with somebody who's focused on family care. Not all chiropractors are family wellness or prenatal. So there might be maybe 100 chiropractors in your community, but maybe only 2 to 5 will focus on family care. And so that's who you want to do, is find a specialist who would reflect the kind of relationship that you're looking for.
Mm-hmm. And can you also share with our listeners how they can find out more information about you, what your website is?
Oh, absolutely. My website is drclaudiaanrig.com, DrClaudiaAnrig.com. And there, typically, or you can like me on Facebook. Typically, my website there, you'll see that my outreach is I want to be the educator towards family wellness chiropractors. And so as chiropractors will find there, or, as a lay person, you might find information there. There's a free stuff area where you'll find sometimes research that I found that I post up there. But often you'll see a lot of, for chiropractors, education that I've created, something I do in my own practice. I'm trying to get the message out for other chiropractors to have more parent education so you can help raise a healthier family.
Mm-hmm. Well, God bless you. I'm so grateful to have you as my coach, for sure. Any last thoughts you wanted to share with our listeners?
Yes. I really appreciate Dr. Brayton taking the time to do this podcast, because it's really important to get the message out in as many mediums as possible. And I want to give kudos and just what a wonderful changes that I see that with Dr. Laura, what she has done in practice and her commitment to the prenatal and preconception care, and the fact that she hosts workshops and she's out in the community. She's a real leader in our profession and what she's done in Hoboken, and she's known as a family wellness chiropractor. She's a prenatal chiropractor out there. And what you want to do is really find alliances find a doctor who's just passionate about care for pregnancy and for children. And I really want to thank Dr. Brayton for putting on this podcast today.
Oh, well, thank you so much, Dr. Claudia. This was such a pleasure. Thank you.
You're welcome.